Hi, my name is Leon Kavaler. I was brought up in the Five Towns area of Long Island. My dad was a chiropractor. My mom was a housewife, stayed home and raised two beautiful boys. And my dad's practice was actually in our home, in the basement of our house. My dad was the only person in the family who really had an education. His parents were immigrants. My mom's parents were immigrants, so no, I had no pressure. I needed to just be the best person that I could be. I always enjoyed music as a young adult, and I took up playing the bass guitar, and I was in several bands in high school. Prior to that, believe it or not, I had an interest in automobiles, and I was a valet car parker at a beach club. And I took the money that I made there, I bought my instruments and my amplifier, and then I decided time to go to college and grow up. When I decided to go to medical school and got accepted to medical school, I came home and I had in my kitchen a white coat, just like this. And that was bought by my parents. When I decide to do something, I need to do it. And I got a 3.9 average in my 4 years coming from being a musician. And then I went to medical school up in Syracuse. Well, I wasn't sure that I wanted to go into gastroenterology in medical school. I just knew I wanted to be a physician. And then I matched in a program of internal medicine at Mount Sinai in New York. I've always been from New York, so I wanted to return back to New York. I was born in Brooklyn and raised in Long Island. And during my time at Mount Sinai, we've had so many thought leaders and true giants in the field in gastroenterology. That's where my interest in gastroenterology really arose. So one of my mentors at Mount Sinai was Dr. Jerome Way, who was a true pioneer in the development of the colonoscope, the instrument that we use for colonoscopy. So I was trained by him, and I spent time in his office, and I've developed a very strong interest in colon cancer screening and prevention and the procedural aspects of gastroenterology. A gastroenterologist is a specialist within the field of internal medicine. So typically patients will go see their primary care physician first, and then they will be referred to us if they have abdominal pain, if they have a change in their bowel habits, if they have blood in their stool, if they have acid reflux, things like that. I think it's difficult for a patient to talk about parts of the body that are considered taboo or can be embarrassing. And certainly in the field of gastroenterology, some of those areas definitely are there. So dealing with stool and diarrhea or constipation or vomiting can definitely be embarrassing for a patient, anxiety provoking. But you have to realize that we do this every single day, and those areas of the body, why is it any different than your finger or your arm? What I bring when a patient is in my office and I know and I can sense that they want to talk about something embarrassing, first thing is you need to listen. Second thing is you need to treat the patient with respect and make them aware that you're here and I'm here for one reason. It's to make them better. And when they feel that way, I think they open up. And I keep a box of tissues on my desk all the time for people who may get upset about something they want to tell me, whether it's about a family member, whether it's about a symptom that they have. So it's really just listening to the patient and treating them the same way that I would want to be treated when I go to the doctor. And that's the way that my dad always taught me. Sometimes I think it's important when we're talking about a situation that might be a little uncomfortable for a patient to interject some humor, to make a patient laugh. Oftentimes you don't know who you can be funny with, who you can make a joke with. It's all about feeling the patient and getting a sense of who's in front of you. And you also want to be a little bit like a chameleon, where you change your colors based on the situation that you have in front of you. So again, it all boils down to being one with the patient and being on the same page as the patient. And then I think it always works out. I married the greatest woman in the United States of America, Jill Kavaler, who went to medical school up at the University of Pennsylvania, and went to medical school at the University of Pennsylvania, and came to Mount Sinai where I met her. She's an anesthesiologist, so she did 1 year of medicine at Mount Sinai, and at that time I was the chief medical resident in internal medicine, an honor that I'm humbled by and very proud of. She then went back to the University of Pennsylvania to do her anesthesia training, and after 1 year we decided we couldn't live without each other, so we got engaged, and she came back to New York to finish her training at Mount Sinai. And she was trained to be a neurosurgical anesthesiologist that she did for many years at Mount Sinai. And then we decided, you know what, maybe we should work together because she feels the same way I do about patients. And we've been working together. I do colonoscopy and she gives the sedation for the colonoscopy, and we've been doing that together for about 20 years. I spent about 2 weeks in Africa on a safari, enjoying the beauty of the landscape. I went with my wife and my 2 kids. My daughter Melanie is now 24. My son Michael is 22 years old. And my wife and I spent 3 days touring the hospitals and the clinics in Zimbabwe. And it really made me realize how fortunate we are in this country. We all complain about the healthcare system. And I visited a makeshift hospital in Zimbabwe where a woman had just given birth the night before, and there was no electricity in the hospital, and she gave birth and was in labor in the evening. And I said to the doctor, "How did you do that in the dark?" And he said, "We used candles." And then I came home, and when I sat in my office, I thought, you know what, I'm very fortunate. The first honor that I've achieved in my profession was serving as a chief medical resident at Mount Sinai. I also volunteer for the New York Police Department as an honorary police surgeon, and I also am a police surgeon for Bergen County. Gastroenterology has afforded me the ability to kind of be like my dad was, or be the hometown doctor, while at the same time use my hands to do colonoscopy and to do endoscopy and to do minor surgical procedures.